Hello students, welcome to MCQ video discussion on Medico apps. I, Dr. Ankita, will be discussing today a MCQ on Pontics. Now, Pontics is basically a prosthodontic topic and we will be discussing a MCQ on that. But before that, I want you to subscribe our BTS YouTube Express channel so that whenever I discuss such kind of MCQs and important short concepts on dental topics, you will be notified for all those. So let's start by hitting the bell icon and then let's resolve the MCQ for today. So the MCQ here, as I have mentioned, is a MCQ on Pontic. Now, Pontic is basically a prosthodontic topic and this question has been asked in the AIMS as well as in All India PG exam. Now, the key point here, the question which is asked here, let's resolve that. So, the question states that the most appropriate Pontic design is. So, the keyword I have already told you that the keyword is you should know about the Pontic. And the options here related to this question are option A, it should fill the missing teeth area. Option B, greater lingual embrasure. Option C, should contact mucosa but should not irritate it. And option D is none of the above. So let's start by understanding what exactly does this question means. So basically this question is asking you about the ideal requirements a Pontic design should have. But before that, do you know what exactly is Pontic? So for a brief introduction of Pontic, I won't be getting into a detail about this Pontics, but I will definitely give you a brief about what exactly is Pontic. So, FPD, when I say the word FPD, that is fixed partial denture, it has many components. And among all the components, Pontic is one of the components of fixed partial denture. Please focus on my words. On fixed partial denture, it has many components. Pontic is one of the components. Now, what exactly do you mean by Pontic? So, Pontic is an artificial tooth. Now, where is this artificial tooth being used? So, here, as you can see in this image, if a missing area is present in a dental arch, like for example, this is an edentulous space or a tooth is missing in this particular position. So whenever we are going to give a prosthesis, we are going to use a Pontic. Now, where is the Pontic used? So as you can see in this image, these are the two natural teeth which you can see. And these two natural teeth are called as abutments. These abutments are made accordingly, they are made smaller in size so that the prosthesis can fix on these two abutments, okay, these two natural teeth. And the mid portion, the portion which is covering this edentulous area by the prosthesis, the tooth which is going to be fixed on this abutment is known as retainer, whereas the middle portion, the area which is filling this edentulous ridge or the edentulous area is by a particular artificial tooth. And that particular artificial tooth which is filling this missing area or which is restoring the function of this tooth which is being replaced is known as Pontic. So if this is a prosthesis which we are going to give, for example, and this is the missing area, this particular tooth is the artificial tooth which is replacing the missing area and restoring the function is known as Pontic, and the other two which are going to be placed on the abutment tooth, the natural tooth which we have made, are known as the retainers, and the ones which is connecting these Pontic with the retainer, they are known as connectors. So I hope you are clear with the idea that what exactly is Pontic and what we are going to call it as Pontic, because personally an examiner had asked me what exactly is Pontic during the Viva. Now, along with that, with this important piece of information to you that what exactly is Pontics, now there are certain ideal requirements which a Pontic should fulfill when we are giving a prosthesis into the patient's oral cavity. So let's see what are those ideal requirements which a Pontic should fulfill. So firstly, as I have already told you that the Pontic should fulfill these missing areas, okay. Pontic should fulfill the missing area. Along with that, You must be wondering that if it is only replacing the missing area, no, it is not only refilling the particular space, it has to even restore the function of the tooth which is being replaced by this Pontic. So for example, if this is first premolar and this is second premolar, so the function of premolar should be fulfilled by this Pontic which we are giving to the patient. So what is the main first ideal requirement which is required? It should it should replace the missing area, plus it should also restore the function of the tooth which is being replaced. This is the first ideal requirement of the Pontic. The second ideal requirement is that it should provide good aesthetics to the patient. It should not look aesthetically bad. So it should have a good aesthetic so that the patient should be happy with your prosthesis. The third one is that it should be comfortable to the patient. It should not impinge the oral mucosa of the patient. Okay. The fourth ideal requirement is it should be biocompatible. Definitely, if we are giving something into the oral cavity, it should be friendly. It should be oral friendly. So it should be biocompatible and should not impinge the tissues. Okay. Now, continuously, if a prosthesis is impinging on the tissues, what will be the result? It will definitely produce ulceration inside the oral cavity. So we don't want such kind of Pontics if it is impinging the oral mucosa. After that, the fifth important ideal requirement is that it should be in contact. That means it should sit on the edentulous area which and where we are giving this prosthesis. But first of all, you need to understand that it should be in contact with the mucosa. That means if this is the ideal space, if this is the edentulous space where we are putting this Pontic, it should just be in contact with the oral mucosa. It should not lie on the halfway. Okay, it should not lie on the air, because if it will be like this, can you even imagine that the oral hygiene can be maintained in such situations? Definitely not, because the food will get accumulated and there will be accumulation. And if there will be accumulation of food, will there be any hygiene maintenance in the oral cavity? No, we cannot maintain oral hygiene in such patients. So the fifth important ideal requirement is that it should be in contact, but it should also permit the effective oral hygiene of the patient. Okay. And how effective oral hygiene? By easy cleaning and easy to maintain it. Okay. The patient should not have a huzzy-buzzy thing that he has to maintain or she has to maintain this Pontics. Okay, so we have to take care of the ideal requirements when we are giving Pontic to the patient. And lastly, it should preserve the underlying mucosa. There, it should not provide or it should not put lot of pressure so that there will be resorption of the bone and the mucosa. So this should also be followed by the Pontic. So I hope you have understood all these 7 ideal points, seven ideal requirements of a Pontic, that how and when Pontic is given, what exactly is Pontic, and what are the requirements which a Pontic should fulfill. So let's move to our question, back to our question. So here the question had asked that the most appropriate Pontic design. Okay, this is the Pontic design. What will be the important design and what is the ideal requirement? So here the first option is it should fulfill the missing teeth area. Yes, definitely this is our first ideal requirement, but along with that it should also restore the function of that particular tooth. So is the first option fulfilling our ideal requirements? No, it is not fulfilling our ideal requirement. The second one is that there is greater lingual embrasure. Now, what is exactly is the lingual embrasure? So, if this is these are the teeth, the lingual embrasure, if this is the teeth, the lower region which is in contact with the gingiva, the lower region, the space, the contact between the two teeth makes the lingual embrasure. So is this Pontic making embrasures, the contact areas greater? No, it is not making anything like that. So option B is not also true for us. Then comes the option C. So should contact the mucosa but should not irritate it. Yes, this is our answer for the question which I have asked you, that it should contact, it should not be hanging in the air. Definitely it should be in contact with the oral mucosa, but it should not impinge the oral mucosa. It should preserve the oral mucosa by so that there's no resorption, plus there is no ulceration to the oral mucosa. So this is the answer for our question option C, that it should contact the oral mucosa but should not irritate it. This is the complete answer we are looking for the ideal requirement of the Pontic. Now lastly, what there is another MCQ which was asked on this ideal requirement of the Pontic, and that was, if a roughly poorly polished area of the Pontic will be given, what it will lead to? So it will definitely lead to halitosis, discomfort and inflammation of the patient. And I have already told you that how inflammation and how discomfort, halitosis, rough poorly polished areas, because the food accumulation will be there, so there will definitely be halitosis, bad odor from the oral cavity, from the patient's mouth, discomfort because there is impinging of the tissues due to this Pontic which we have given, the prosthesis which we have given. And if there is impinging, there definitely will be first inflammation, and that will lead to ulceration in the oral cavity of the patient. So I hope you have understood what exactly is Pontic, the ideal requirements, and how a Pontic is given. And you can now definitely resolve a MCQ based on this ideal requirements of the Pontic. So just keep resolving such MCQs along with me, and don't forget to subscribe our BDS Express YouTube channel. You can also join our exclusive WhatsApp group on www.medicoapps.org/group, so that whenever I discuss such important MCQs along with short concepts on dental topics, on important dental topics for your examination, you will be notified for all those. So keep watching our videos. Thank you for now. Good day, good luck.